Black Doctors Podcast.
Hello and welcome back to the Black Doctors Podcast. I am Steven, your host. So excited you've joined us for yet another episode. I am coming off of the high, which is the SNMA AMEC. Every year around this time, there's the annual medical education conference by the Student National Medical Association. It's so near and dear to my heart because it's played such a huge role in me ending up where I am today. And I know that's true for so many Black and brown physicians everywhere. Thank you to everyone that came up and said hello during the conference. It was incredible to meet some of you in person, and it is truly humbling and inspiring. It lets me know that I am doing the right thing by recording these episodes and posting, every Sunday night, furiously editing and trying to get the episode out on time because I have procrastinated all weekend. But thank you so much. I was able to meet some of you, talk to some of the other folks at different booths from other institutions, and recruit some inspiring guests to have on future episodes. So it's awesome. Definitely make plans next year to attend. I think it's to be in St. Louis, and you definitely want to be there. If you are a pre-medical student, a medical student, you definitely need to be at the conference. If you are a resident or if you're in graduate medical education, talk to your program, talk to your institution about going there, supporting the SNMA, and recruiting these incredibly talented, diverse healthcare professionals in training. It was awesome seeing Dr. Nee and Renee Darko. They were out there recording. I didn't get to physically chat with them like I usually do every year, but they were out there. Dr. Love Anani got to link up with Dr. Italo Brown, who's been on the show multiple times. Dr. Triggs was there as well. Just an awesome time to be around people that look like yourself. In other news, if you follow me on Instagram, you'll see I'm really jumping into sound wellness. I think it's a space that needs to be incorporated better for Black and brown individuals. I don't see much representation in the space, and I just know from a healing perspective, from a mindfulness and kind of mental health and wellness, different sounds can have that relaxing effect. So that's kind of what I've been exploring, and you can check that out on my Instagram page, Stephen Bradley MD, on Instagram, if you're into that. And I think it's helpful. It's been helping me sleep better, and if I listen for about 90 seconds at the start of the day, just have some meditation and mindfulness, it really kind of helps my day go better as well. The next 2 weeks, we're going to feature a conversation with Dr. Alexis Gaskin. She is a board-certified orthopedic surgeon specialized in total joints, adult hip and knee reconstruction. Incredible story. She is a graduate of Howard University in their orthopedic surgery program. Well, she's a graduate of UC Davis for medical school and attended Howard University for her orthopedic surgery residency. As you know, there are incredibly few women in orthopedic surgery. We are going to talk about that in this episode, either this week or next week. And before we do, she did want to shout out some of her mentors. She mentioned some of them in this show as well. She wanted to specifically mention Dr. Letitia Bradford, Dr. Bonnie Simpson-Mason, and Dr. Craig Thomas. She said Dr. Bradford and Dr. Simpson-Mason have been there for her for the 4 years of medical school. They've been honest with her and helped her perform better, and been some of her biggest supporters as she went into the field of total joints. She mentions that this subspecialty of orthopedic surgery has only 7 Black women in the U.S., so an incredibly small network. And Dr. Craig Thomas is also another mentor of hers who helped her prepare for boards and encouraged her to pursue this subspecialty. One of my favorite parts of this show is when people mention the names of the mentors that got them to where they are today. And you'll hear a lot about the mentor that she had as a student that really held her down and introduced her to medicine in general. So we're going to jump into today's episode with Dr. Alexis Gaskin. Also, you can find her on Instagram at Dr._Lexilu. So Dr._Lexilu. And she is also on Twitter at Alexis Gaskin 32. I'm trying to do better with actually getting people's handles in the show notes. I digress. Here's this week's episode. Hello, welcome back to Black Doctors Podcast. I'm Steven, your host. So honored to be joined by Dr. Alexis Gaskin. She is an orthopedic surgeon. Even more, she's a fellow of the American Academy of Orthopedic Surgeons and she is a specialized, how do you say it? Hip and ankle, knee.
Hip and knee.
No ankle.
Just the hips and knees.
Arthroplasty. There we go. So specialized orthopedic surgeon. And she's joining us to talk about a bunch of stuff. We'll talk about how to get into orthopedic surgery and some of the experiences she's had along the way. Alexis, thank you for joining us.
For having me.
I was going through your profile on LinkedIn. I realized you were at UC Davis for medical school. And I did an away rotation at UC Davis as a medical student. I'm sure you were probably away on your own away rotations.
Yeah.
But yeah, we crossed paths there. And then you did your ortho training at Howard. And we just missed each other because I just left from medical school and then you moved to DC.
We have a lot of mutual friends too. So yeah.
Absolutely. Well, I am so excited to jump into our conversation today. And as always, I start off with your story. So what first got you interested in becoming a physician?
It was actually mentorship. It wasn't until when I was in college that I had a handful of friends and teammates that were pre-med. And it never dawned on me even to go into medicine. I didn't know what it took, didn't know the process, didn't know anything about it. But I saw my friends interested in, and I wanted to do something where worked with people. I didn't want a desk job. So I was like, hey, I like math and science. Why not? And then my mom was a medical assistant at the time. And she had told the doctor she worked for, who was a woman, and she was ecstatic. And so she was like, have her come in. A couple of the doctors, male too, were ecstatic to have me come in. They said, come in anytime you want. So I got to hang out in their clinic, see pre-op x-rays, trauma, and then the post-op x-rays, and kind of see the progress and what they're looking for, things like that. Just as simple terms that early college student would understand. Then they progressed, I think one summer, then I was allowed to go with them in the OR.
Oh, wow.
So then I saw some cases to observe, and I kind of figured in myself, like, if I can handle seeing this, then I could probably do it. If I can't handle this, I might need to look at another field of career. So watched, I think it was ACL surgery, a knee replacement, and some hand surgeries, because the doctor my mom worked for was a hand surgeon. And so then I was fascinated and really excited. So then connected with my teammates at UCSD, where I went to college. And a couple of us were pre-med, like, as I said. So we kind of worked together, studied together. And I still actually didn't know the process. I just took it one step at a time, was like, okay, I got to take this test called the MCAT. Mm-hmm. Sounds like the SAT, but on
steroids.
On steroids, yeah. So I studied that for a summer while we worked out in San Diego, took that, and then I applied. And I had a medical redshirt my freshman year, so I ended up staying last year for college. So I applied during that last year, and I actually regretted it. I was not actually ready for applying. I didn't actually talk to anyone about how to apply, process. And it was just kind of doing classes, doing workouts, traveling for basketball. Probably wasn't the best time for, at least for me, especially someone that didn't know the process. So I did get waitlisted, didn't get in, devastated, of course. Yeah. Didn't know what I was going to do with my life. Still didn't really know the process. But I actually turned back to that doctor that my mom worked for, and her name was Hillary Redlin. And I just said, I don't know what to do. I kind of was counting on this. Don't have a backup plan. Should I retake the MCAT? Should I do this? Should I look to other fields? Like, am I even someone qualified to do it? And so she, very girl power. She was just, and actually a couple of the guys were like, oh, we'll look into nursing or PA school or this and that. And she pulled me aside and said some words I probably can't say on here. And she was like, no, we're not going to let the guys tell you. They wouldn't tell the guys to go do nursing. They wouldn't discourage the guys to redirect them. Like, you can do this and we're going to do this. And so I went in I remember it was a Sunday morning, went into the hospital where she was rounding at the time. Mind you, I still didn't know what rounding meant, but she rounded, and then we sat in her office for about 3 hours, and we wrote out my personal statement, went over my application, like how to fill it out, what things I needed and what I was lacking. She ended up connecting me with some docs at Davis to get some research time since I had time off. And then I reapplied, and it was complete opposite. I was waitlisted at 2 schools. And then the following year, after her advice and mentorship, I think I had over 30 interviews. Wow. And so I was once I got admitted to one, I was like, I'm not going to go out of these things, and I want to give someone else the opportunity. So I started looking at the schools, and I'm like, no, I'm not going to go here over this school. So I was turning down interviews versus begging. So that was the first step to medicine. Then ended up going to UC Davis, which is near home, which was nice, near family and things like that. I wasn't quite set on ortho. I knew that it was competitive. And then I also was like, these are the people that I know. So I probably am biased about going to ortho because those are the ones that helped me because they were ortho surgeons. So I didn't want to just automatically go that way because that's who helped me. So I try to keep an open mind in med school. But I'll be honest, once I got to those rotations, I was like, no, I didn't like medicine. It was the division of procedures or no procedures. So I was like, no, I don't want to sit in a clinic all day. I don't like the idea of giving a medication and then waiting to see how it worked. I liked the immediate gratification of you see a problem on X-ray, you go to a surgeon, you fix it. And obviously it's not all surgery, it's physical therapy or whatever, but you are able to see a clearly defined problem with a relatively quick solution. And then there's the recovery and rehab. So I did gravitate towards that. There were things that I liked about every specialty. I think you can attest. Like there's great things about all of them, but I also thought about the things that people didn't like. And was the good outweighing the things that you didn't want to do kind of thing, if that makes sense. So every job, every place you live, whatever has the positives and negatives. And so I wanted to make sure the positives that I was gravitating towards outweighed the ones that you're like, oh, dang it, I got to do this again. So and talking to residents, talking to attendings, and people that were in practice, not even related to academics, it just seemed that ortho was just happy. Even the bad days.
Even when they're yelling and cussing you out in the OR, y'all are still happy on the inside, huh? Nobody else is happy, though.
It's not personal. It's the case. No.
Gotcha.
So I think I also was very lucky that the majority of people that I was around, whether I rotated with, whether I was being mentored by, they didn't have that stereotype of ortho, of angry, cussing out, throwing things, that kind of thing. So I know historically there were those personalities, but I felt very fortunate and lucky that even my rotations at Davis, my away rotations at various places, I never had that. And it was always, especially the attendings wise, they were always friendly and fun. And obviously there's stressful situations where I'm like, let's read the room, don't talk. Don't get on their nerves right now. So, and I also had the benefit of I played sports. And so I never dismissed that there's some aspects that I did fit the stereotype. I'm 6'1", well, between 6 and 6'1". I try not to claim 6'1", but I'm 6'1". I played college basketball. I watched basketball. I'll go, I'm not a big football fan, but I'll go and watch games and things like that. And so I did fit some of the stereotype, which made it easy to maneuver kind of the social kind of interactions for a lot of times and joke around and everything like that. So it just, everyone just seemed to have a good time. And even when the residents were dead tired at Davis, they were still seemed very happy to be there and looked forward to kind of like the future.
Yeah.
Versus there's other specialties that they seem miserable and every day in and out, the attending seemed miserable. And I'm like, I'm good. So then I decided to apply. I did go for ortho. I'll admit my step one was not ortho star status of 270 or whatever the crazy number is at the time. And I did rotations. And again, I was the type that went and I would rather have the honest truth. After going through what I went through with the med school, I wanted the honest truth about like my application, what did I need to do. I didn't want to apply, and be like, didn't have a chance to get in. So I went to the program director at Davis at the time, Rolando Roberto, and I just put my CV in front of him. I gave him my scores, I asked grades, but we were pass fail at Davis. But I just showed him my transcripts, and I was like, "This is me." And I had rotated with him too. And as a third year, like, "This is me. What do you think? Be honest. Should I take a year off? Should I do this?" And he was like, "Hey, well, do you take your step 2? You need to get above I can't remember, it was 230 or 240. And then we can talk." He's like, "If you don't, we won't interview you, and most of the programs won't." And I appreciated the honesty, because as much as we can have dreams and hopes and goals, I wanted a realistic expectation. So how do I I always say plan for plan A, plan B, and plan C kind of thing, but at least have a plan B. And so, especially after, like I said, going through med school and the wait list, I didn't want to go through kind of the unexpected. So I worked my butt off, studied, and I surpassed the number that he had given. So then I went to him again. I was like, "So what do I do?" And he was like, "Go ahead and apply." He's like, "I don't think a year is going to make research is going to make a big difference for you." And then he actually helped me get a away rotation at a program in Arizona, and amazing program, incredible faculty, super nice. And again, I was there for a month. They didn't know me that well, but extremely supportive and things like that. And so, again, I feel very fortunate on the connections that I had made and things like that. Him even setting me up for that away rotation, things like that. So, and I applied, and again, I didn't get the 15 interviews that they say you need to match, which, again, uneasy feeling.
Yeah. I'm sure the number's higher now. Yeah.
Yeah. I think I had 5. So very terrifying, as you can imagine, especially in ortho. Is still one of the most competitive specialties. So applied, interviewed, and matched at Howard, and it was great. I'll be honest, and they know too, that I was not wanting to leave California. I was born and bred in California. Yeah. Did my training at UC's, and it was just like, okay, here we go. But I do remember an attending at Davis who actually she had helped me get the research before med school. She was like, because I was like, I want to go to Davis. I want to stay there. And she's like, "I really think that people should go away, get training in a different environment, different culture, especially different region, and I'm sure you've seen as you've moved around, the culture of medicine is very different in the East Coast, the Midwest, the West Coast." And so she was like, I encourage everybody to leave, and then you can always come back and bring something new to the department and to our area. And I just felt crushed. I was like, she doesn't want me. So, but turns out it was amazing experience. My attendings, the experience at Howard was amazing. And the fact that I still talk to probably half my attendings, still connect with them when I go out there, see them at Academy. And it's just, I've actually called a couple of them being on call early on, like,
"Oh, wow.
Hey, I got this hand case. What would you do?" When patient was like, didn't want to stay because he didn't have insurance. How do I monitor and all that stuff? And like literally a couple of the attendings have picked up their phone at like almost midnight East Coast time. So I again feel very grateful for the relationships and experience that I've had, and having mentors and people that like really have my back. So I think in so many ways I've been lucky the entire course, whether not being the perfect straight and narrow pathway. I've had mentors and people there that have supported me more than I even realized at the moment, and forever grateful. So I still text Dr. Redland every time, like as I've graduated, finished fellowship, passed my boards, passed my oral board. So, and she's just always like, "You're going to make me cry." So that's kind of how I ended up in ortho. Not a simple path, and not floating on cloud 9 being like, "Oh, this is easy." But it was a long road, but definitely it's still the specialty. I don't see myself in another specialty. There's definitely days where you're like, oh, this has been rough, but I don't know what else would keep me going like ortho does. So
I love that, because when you see attendings in their specialty, it looks like they never had to sweat a day in your life. They're just living their best life. They're operating. They're making a ton of money. And your story is so ridiculously similar to mine in that I didn't know what I was doing when I applied. I was a pre-physical therapy major, so I had to shadow. And it just so happened I was able to shadow Dr. James Andrews at the Andrews Institute. Didn't know, no idea he was a world-renowned orthopedic surgeon. And so I was like, oh yeah, I want to do ortho. This is me. And then I showed up at Howard and I met the other ortho people. And I'm like, ooh, so far behind this power curve. Like I'll never catch up. And then I was lost for a little while. But yeah, your story just resonated so much with the lack of mentorship. I did want to highlight a couple of takeaways. Dr. Redlin, man, it's incredible that mentorship that you were able to develop. And for the listeners, true mentorship comes from building relationships, and it's a two-way street, and you got to put work in. There's like pay for play. You can get on social media, find somebody and pay them to review your personal statement and to get these opportunities. But to really have somebody go to bat for you in the way that Dr. Redlin did for you, it takes a personal relationship. And that's just so beautifully evident in your story. Second, go ahead.
Thing I do want to add about her is that we were complete opposites. So her dad was an orthopedic surgeon. She came from very well off. Multiple people in her family were medicine, college, all that stuff.
Oh, wow.
And she's Jewish. And I'm first generation college student. No one in my family went to medicine. This is also why kind of mentorship was a little scattered too. And just emphasizing the Linda Suleiman always says that the non-congruent mentorship, patient-doctor relationship, but completely non-congruent, other than being a woman, but such different backgrounds. And she actually was the one that reminded me, don't be ashamed of it. Don't make people think that just because if they're looking at you because you're first generation, or if they're looking at you because you're a woman and they need to add to their class, or because you're Black. She was like, there's so many ways people get their foot through the door that are not explicitly said like that. And she said it. She's like, I had opportunities because of who my dad was. And what is the difference in that? And so she actually empowered me to not feel some like that shame or guilt that people try to put on there, being like, oh, you only got in because you're a woman, or you only got in because you're Black. And it's like, wait a second. Well, but are we looking at your application and the things that got you in, like your dad or your uncle or your aunt who's on the board of trustees or whatever? So she actually made me feel so much more comfortable and not let those comments deter. And so to her credit too, and for anybody going out for mentorship, you don't have to find someone that looks just like you or had the same exact route as you. As long as if they can understand and appreciate your unique characteristics and how to best utilize them, that was definitely one of the biggest things I learned very early on with her that helped even to this day.
That's incredible. We have to talk about your basketball career. Tell us, what you were all right. You were decent. It sounds like.
I didn't know what I was getting to in high school. I actually did not play sports until high school.
Oh, wow.
And I had a coach. I mean, again, I'm 6'1", walking around freshman, and the coach came up to me and was like, "Are you trying out?" And I was like, "No."
Trying out for what?
Trying out for what? He's like, "Basketball." And I was like, "No." And he was like, "Why not?" I was like, "Well, first, I've never played. And then last year in 8th grade junior high, my friends begged me because they needed someone tall. So I tried out, and there was 3 other girls around my height. And I was faster than them, more agile. No, I didn't shoot the ball well because I didn't really know how to shoot. But every other metrics I was on top of, and I got cut. I was like, I'm not doing that again. I'm not getting burned twice. He's an idiot and everything. So For some reason, I ended up doing it. So I tried out. They put me on freshman. I was on the freshman team for about 2 weeks, 2 to 3 weeks, enough to learn how to shoot a free throw, do a layup, and some rebound techniques. And I got moved up to JV.
Big leagues.
Yeah. So then I was on JV for 2 years and then moved up to varsity. Didn't think I was going to play in college. It wasn't one of the things that I was like, okay, I have to play. I did have this like now love of the game and want to play more, but I was like, realistically, I'm not going to pick basketball over school. Mm-hmm. And at that time, there was no NIL and there was very little money in female sports. The WNBA at the time had a salary cap of, I think it was like $80,000. So like Lisa Leslie, like Cheryl Swoops, like the top players, like Hall of Famers were getting that max amount. Most of the players were getting like maybe 30,000 a year. Yeah.
And this was not that long ago. This was
no, this was just recently when they changed that. And then you'd have to go to Europe to play overseas and hope you get a better contract. Then that's where you got into the 6-figure salaries. But again, I just started playing in high school, so it wasn't my career aspirations. So I figured, I started getting letters from colleges, but they were like liberal arts. And I will tell you, I am not liberal arts. I like math and science. And I was disappointed when I found out I had to write lab reports because I do not like having to write stuff. So I was like, this is not the school for me. Like, these are not the schools for me. So, and at the time I knew I wanted to do something in math and science kind of thing. So I got my tape. I didn't exactly have support of the coach at the time. So I essentially got taped myself, VHS, old school, I think, or no, I think it was DVD at the time. My parents helped me create a little DVD and we sent it down to UC San Diego because I had applied there. And they were like, oh, we'd like to talk to you. So went down for kind of an unofficial visit, met the coach and a couple of the players. And I don't know if you've ever been to UC San Diego, but
no.
It is gorgeous. And it's hard to say no if you, once you get to that campus and once you see La Jolla. So I was sold and they're like, we'd love to have you on the team. So that's how I ended up there. Kind of crazy. Again, not having a ton of years of experience and tough times there. I would not say it was a easy experience with playing, school, and coaching, but got through it, and then also have teammates that I still talk to this day, but still close. So there's definitely things I love and still value. I will say it made residency a whole lot easier because having to run 3 miles and suicides and all those drills at 6 a.m. I was just like, the physical demand of ortho is nothing compared to, what I did during college basketball. So that kind of was never an issue. The 24-hour shifts, that was just was hard and the mind fatigue, but physically, yeah, nothing and even some of the mind games that coaches play, it was like
a piece of cake.
Residency was nothing. I was like, I could tell you some stories. So, but yeah, so I ended up being there for 5 years because my intern year, I had a medical red shirt. So
okay.
We did pretty well. Thankfully, I did not, spend all that time on losing. So we made it to playoffs every year. We made it all the way to technically the Final Four, but we were Division II. So I don't know if you also know, Final Four was exclusively for men's Division I until just recently. So now women's Division I can say Final Four. So just a little more drops of history.
You're us up for our final topic. Yeah.
Yeah.
Oh, gosh.
So yeah, we made it all the way, and unfortunately, yeah, we did well. So
that's awesome. We're not going to get into my sports career. It's non-existent, quite embarrassing. I think the one season I played basketball, I was in 7th grade, and I just started wearing glasses. So I had the glasses strap, and I was the only black kid on my team. Yeah. There was 3 of us in the league. And I think my points for the whole season were like 6. I think I made 3 baskets. It was pretty abysmal.
Hey,
and I had to keep getting
you
out
made
there.
some shots in the game. You know what?
Yeah. Well, that's one and done. Let's see, I didn't get invited back.
Yeah, at least you're aware of it versus some of the guys at Howard, they thought they were in the NBA. And so I definitely made sure it was known when they got a little hot-headed that I was the only college athlete here.
We're going to get some names or no?
Yeah. Oh, Kojo Marfo.
I'm not surprised. Not surprised.
Yeah, right.
Oh, man. Well, I have to say the people that I know that are in orthopedic surgery are impressive, but the woman orthopedic surgeons I know, Dr. Linda Suleiman, who was a couple years ahead of me at Howard, she had her sights set on ortho and was one of the most determined, dedicated people I knew in medical school. I just looked up to her. Dr. Noelle White, we were residents together at the University of Chicago. She was the only Black woman ortho resident in this sea of big white dudes. And she, like, every day just came to work and just took care of business. And when you, mostly through social media, but nonetheless impressive, it speaks to how you have to be stellar and incredible as a woman, as a minority, double, triple minorities, to get into the field of orthopedic surgery. The numbers are abysmal. The last report I saw were about 15% of orthopedic surgeons in training were women and 7% of orthopedic surgeons practicing were women. I don't know if is that fairly accurate?
Yep. The last numbers I know that is, it's getting better every year. You see
Thank you so much for joining us on the Black Doctors Podcast. If you enjoy what you hear every week, please leave us a review, leave us a comment, share with someone you know can benefit from this episode. Maybe they're interested in going into orthopedic surgery or matching into a male-dominated specialty, which is probably most of medicine. Regardless, we appreciate your help helping the show to grow and reach more ears. Again, thank you to everyone that reached out this weekend and we were able to meet with, and just that encouragement. It means so much to me and lets me know that this is all worth it. So thank you for tuning in. Join us next week. We're here because representation matters.